The behavior of the virus also, which is not, I said it many times, is not COVID. So if you add all that, I think that's where it comes. When I say not worry, it doesn't mean that there are no issues here, but it means we can handle it, and it can be handled.
We have finished the first day of the evacuation of the Endius. The operation has gone well, and according to the plan, we have disembarked 94 people of 19 nationalities, 7 flights with 8 nationalities and 1 with 11 nationalities, the flight of Netherlands, and one of the French citizens has had mild symptoms during the flight, and the French authorities will proceed to implement their control and their protocol. One more time, I want to thank the WHO, the ECDC, the European Commission, the DG ECHO, of course, all the institutions and all the governments here in Spain, the army and the ministers that are here, and of course all the governments and the commitments of all the countries that have been involved in this operation, and we have a very good cooperation and a very good day today.
9 News Australia here, I'll be quick. Firstly, thank you very much, you've all been doing a great job. When can we expect the Aussies to come off, and how are they going?
Come off all the operation?
The Australians, when can we expect the Australians? Yeah.
I think
6 p.m.
Tomorrow 6 p.m. We hope. I don't know if the plane is. I think that the plane is going to arrive tomorrow. It's going to arrive tomorrow in the morning, and we expect that tomorrow at 6 p.m. We'll leave the flight.
And they're doing okay?
Okay.
The Australians are doing okay?
They're doing okay.
Yes, of course. Okay, you are Australian. Yes, of course. Okay, sorry. Yes. I want to say that all the governments are very committed with this process, with this operation, and we have had a very good collaboration with all the governments, with all the institutions. It has been very, very, very nice. Thank you very much.
If I could ask you about the WHO advice for the passengers returning home, what is the isolation or the quarantine period that these people should follow? And if it's true that the United States is not going to follow that, it is not going to advise or impose any kind of quarantine, any kind of isolation?
Yeah, so our advice is clear. Starting from May 10, 42 days with active follow-up, 42 days of quarantine. But it could be in a facility or at home. Of course, countries, we advise them, but at the end of the day, we don't impose. Countries follow their national guidelines, and based on the risk assessment, they can implement, but our guidance is very clear, and it has already been released.
Do you have any response to the fact that there might be a country that is not going to follow those guidelines?
That may have risks, but of course we don't force them except proposing. Thank you.
Sadia Chowdhury from Sky News. Madam Garcia, a question to you and also to Dr. Tedros. Why should we not be worried about the French case? Why does that not worry you?
You want to start?
No, for
you. There was a question to a minister actually about one of the passengers not wearing a mask. I saw that in the picture also. It was hanging on one of his ears. And, many of these passengers are elderly. And you can imagine how uncomfortable could be when you have especially FFP2 masks. So I just want to say that, understanding their situation is very important. I remember one of the passengers in the ship saying, "We're not headlines. We are human beings. We have lives, and it's true. And they have families, their mothers, their fathers, or their children. Children and everything." Then, when it comes to this question. Of course, there could be symptoms, but it may not be even associated with hantavirus. Of course, it should be checked. But with age comes many health challenges. That was actually one of the concerns we had with this ship, because many of them are elderly and they have many other chronic conditions. And there could be symptoms associated with those. So there are symptoms. It doesn't mean that it's related to hantavirus. But of course, it may also be. But I know the French experts will do all that's needed to manage this. And that's why we say, when you see it from different angles, this may not be a concern, but at the same time, all the preparations also gives us confidence, and the behavior of the virus also, which is not, we said it many times, is not COVID. So if you add all that, I think that's where it comes. When I say not worry, it doesn't mean that there are no issues here, but it means we can handle it, and it can be handled. Thank you.